Really a pleasure to introduce everybody to Dick Wenzel, Dr. Richard Wenzel. He was the former chief of medicine at Virginia Commonwealth School of Medicine. And prior to that, he was the head of hospital epidemiology at the University of Iowa and had one of the, if not the premier program in hospital epidemiology. Everybody I knew wanted to train under Dick Wenzel. So Dick, I want to ask you, you have tremendous insight into this COVID-19 outbreak. And I heard a wonderful talk by you just yesterday, and I wanted the students to share, I wanted you to share with our students a few of the key, I call them pearls. And the first one was the importance of rapidly responding to an epidemic and the difference between China and Italy.
Okay, so thanks, Fred. It's a pleasure to be with you. And what's on the y-axis or vertical axis, a number of deaths in each of the countries shown separately after that country had 10 deaths. And that was done to sort of level the playing field, all countries starting after 10 deaths. And on the y, and that's on the y-axis, on the x-axis or horizontal, a number of days since the 100th case. And so this is a cumulative number of all deaths in each country. And with this kind of curve, what you want to see is that instead of going straight up in a line, they begin to see the curve bend to the right. And that means as it gets flat, there are no new cumulative cases, and that country is on the way to, if they haven't already, controlled the pandemic. Now, you can see some countries that you have there. Fred has South Korea on the top in blue color, and they've leveled off. And they were very aggressive getting out of the starting line, not only with social isolation, but also with probably the strongest program of contact tracing of infected people, finding who they are, and then isolating the positive. So not just South Korea, but you see Japan has begun to level off and get away from the line. It's China. And the important thing about China is it leveled off very early with a fair number of cases that died. They began their lockdown after only 30 deaths. In contrast, if you look at the straight line, Italy, Iran, UK, and the US, even in sort of the middle in red, pretty much straight lines. And if you remember, if China began the lockdown after 30 deaths, one of the key points is it took Italy 800 deaths before they went into really strict lockdown. And the point of this slide is early, aggressive social distancing, along with early and aggressive case finding, will control this epidemic earlier than if you had waited.
That I really liked is the way you recommended following the epidemic curve is to calculate the doubling time in days. And so if you could share that, because I was very impressed by this particular parameter, is very useful in following an epidemic.
Sure. We're going into, as of April, pretty much national. We have a few states that haven't quite come over yet, but almost national lockdown, if you will, people staying in place. And so if you look at the US scenarios by May 1st, there are three that I've outlined. And the way that I've stratified these is how many days to double the current numbers. Either every 3 days we double our existing numbers, every 5 days, or if we're lucky, only every 7 days or longer. Now we know that we have 200,000 reported cases, And many experts, such as Zeke Emanuel, say the real number is probably 5 to 10 times that. And he would say, yep, there might be 2 million. What I've said very conservatively on the top line, reality may be 3.75 times that number, or 750,000. So if we start on April 1st, yesterday, with 750,000, and we're on every 3-day cycle, we'll double that number up to 1.5 million by April 4th in the 3-day cycle, April 6th or April 8th in the 5 and 7 day cycles. Now, in a month that has 30 days, if you have doubling every 3 days, as New York did last week and the week before, you'll have 10 cycles of doubling in that month. If you look to every 5 days, and again, if it's every 5, then you have 6 doubling days in a month with 30 days. And 7 days cycles where you double, then we have 4 generations, if you will. So if you then take those very few assumptions, the cases we can expect with every 3 days, this is what's going to happen throughout the month of April, which I don't think is going to happen. We would have the entire country infected. That'd be over 300, with the country of 330 million, a 1% mortality would be 3 million deaths. Fortunately, we're not going to do that. We've already done some things in March, and we're going to do even more aggressively in April. But look at every 5 days. Cases by May 1st is 48 million, and that's still only 15% of its citizens if that were to occur. But a 1% mortality would be 480,000. I think we'll do better, and I'll pick the last example. If we have 4 cycles of 7 days doubling, we would have 12 million infected. That's about 4% of citizens, but still 120,000 deaths with a 1% mortality in the ballpark that, Tony Fauci was saying just the day before yesterday. I think we might even, if we're really fortunate and really tough, when we don't let our guards down, we can extend the doubling time beyond 7 days. Imagine every 10 days. So you only have 3 cycles. That'd be 6 million people, 60,000 deaths, much better than some of the best case scenarios we might be able to imagine from a distance. And the only other thing to say, if you look at the cases, remember 5% of the cases are admitted to hospitals. And if patients are admitted, a third of those admissions in many places go to the ICU. So I think one of the take-home points is don't just follow the cumulative number of deaths as the first slide, but look at the doubling time. Listen to the governors in each state say, we were at 3 days, we were doubling every 3 days. Now we're at 6, now we're at 7. Even New York has improved just in the last few days. That's going to have a very fortunate impact in a state that's been terribly hit.
And Dick, I think the important thing, which these numbers really emphasize, is that people really need to follow the directions of the government and the requirements of social distancing, or we won't achieve these numbers.
Absolutely true.